Let's talk about the pathophysiology of Parkinson's disease. Firstly, what happens is the degeneration of dopamine producing neurons in the substantia nigra, a crucial part of the midbrain, is a central feature in the pathophysiology of Parkinson's disease. In a healthy brain, there are special nerve cells called dopaminergic neurons located in an area known as the substantia nigra. These cells send signals to another part of the brain called the striatum, which is important for controlling movements. Dopamine is like a messenger that tells your brain when and how to move your muscles. The substantia nigra is divided into two parts, as you can see in the picture, the pars compacta and the pars reticulata. The pars compacta is particularly important in Parkinson's disease because it contains the majority of the brain's dopaminergic neurons, those that produce and release the neurotransmitter dopamine. Second is neuronal death. So in Parkinson's disease, dopaminergic neurons gradually start to break down and die off. When this happens, the brain doesn't have enough dopamine to control movements properly. Some scientists aren't completely sure why these neurons die, but they have some ideas. Here are a few things that might be causing it. One is oxidative stress. This is like rust building up in the brain, just as metal rusts when it's exposed to oxygen. Cells can get damaged by certain chemical reactions in the body that produce harmful molecules. These molecules can hurt the neurons over time. Mitochondrial dysfunction. Mitochondria are like tiny power plants inside cells that provide energy. If they stop working properly, the cells don't get enough energy, which can lead to cell death. Last one is neuroinflammation. This is when the brain's immune system becomes overactive, leading to inflammation. While inflammation is normally the body's way of fighting off harmful things, too much of it in the brain can actually damage neurons instead of protecting them. The second part is disruption the normal balance between dopamine and acetylcholine in the basal ganglia. Dopamine and acetylcholine are two important chemicals that help control movement, especially in a part of the brain called the basal ganglia. The basal ganglia act like a command center for coordinating and regulating smooth, purposeful movements. In Parkinson's disease, the neurons that produce dopamine gradually die off. As dopamine levels drops, this delicate balance is thrown off. With less dopamine around to counteract it, the effects of acetylcholine become more pronounced. Excessive accumulation of acetylcholine causes symptoms of both muscarinic and nicotinic toxicity. These include cramps, increased salivation, paralysis, diarrhea, and blurred vision. So this disruption leads to the typical symptoms of Parkinson's disease: tremor, rigidity, and bradykinesia. Slowness of movement occurs because low dopamine levels make it hard to start and control actions. Rigidity results from the increased influence of acetylcholine causing muscle stiffness. Tremors arise due to the imbalance between dopamine and acetylcholine, leading to abnormal signals that causing shaking. Now we are talking about the medication for the Parkinson's disease. So we have levodopa is the most popular one. It belongs to the drug class known as dopaminergic agents. Levodopa is a medicine used to treat Parkinson's disease by increasing the amount of dopamine in the brain. In Parkinson's, the brain cells that make dopamine start to die, which leads to movement problems because dopamine is essential for controlling how we move. Levodopa itself isn't dopamine, but it can be turned into dopamine once it gets into the brain. However, if you take levodopa by itself, a lot of it turns into dopamine before it even gets to the brain, which can cause unwanted side effects and doesn't help as much. That's why levodopa is usually combined with another drug called carbidopa. Carbidopa stops levodopa from turning into dopamine too early, allowing more of it to reach the brain where it's needed. Once in the brain, levodopa is converted into dopamine, helping to reduce symptoms like slow movement, muscle stiffness, and tremors. For Emma's case, Emma needs to be educated about the importance of taking her medication exactly as prescribed. Even if she feels better, missing doses or suddenly stopping the drug can lead to a serious condition called neuroleptic malignant syndrome, characterized by high fever, confusion, and muscle rigidity.